That's after that man in New York State became the first patient to contract polio here in the U.S. in nearly a decade. Yes, since vaccinations like these started back in the 1950s. Experts like Dr. Peter Salk, whose late father Jonas developed the polio vaccine. Well, he says the public shouldn't be alarmed about this case in the U.S., but he does warn that children unvaccinated for polio could be at risk. 92% of the U.S. population is inoculated against polio, but Peter Salk says the virus is still a threat to populations in other countries. When U.S. citizens who are unvaccinated against polio travel abroad, he says there's not always that threat they could bring the virus home.
And while that polio case was found in New York just a state over, we wanted to know here at home what the threat could be to us here in Erie.
Yeah, our Megan Selensky is sitting down with Dr. Becky Dawson, epidemiologist from Allegheny College and Erie News Now contributor, to talk about how to best protect ourselves. Good morning, Megan.
Mark, Brissa, good morning. As we've been talking throughout this morning about that polio case that was found in New York, our viewers at home are wondering, Dr. Becky, is this something that we should be concerned about?
I think it's something we should be paying attention to, especially if we are anti-vaccination. If we haven't vaccinated our children or ourselves against polio, this disease is 100% vaccine preventable. So the real concern is getting that vaccine.
And is that how we should go forward with preventing getting polio?
Absolutely. Everyone needs to be vaccinated against polio. We are giving the what we call the Salk vaccine, so Jonas Salk's vaccine. It is a 3 or 4 dose injection vaccine, but you really should have those first 3 doses before you're 2 years old. So this is a time to get your kids vaccinated because we know that polio is spreading in the state next door.
For those people that are concerned that they might not have gotten the vaccine when they were 2, how do you go about finding out your vaccination status and if you do need to get this vaccine?
So you should have records. You should have vaccine records. It might be worthwhile talking to your family physician to see if they have records of it. Talking again to the state health agency if there are vaccine records there. But if you are concerned that you don't have it, talk to a physician and ask whether you should be vaccinated or shouldn't. This is a great time to have conversations with the people that are providing healthcare for you.
Although about 92% of the country has had their vaccine, if there are some adults that haven't gotten it, is the vaccine any different as an adult than as a child, or should they be concerned about getting that vaccine as an adult?
No, so I think, again, the polio vaccine has been given since the 1950s. We know it's safe and it's effective. So this isn't a vaccine that you should be worried about getting, but it's a vaccine that you need to get, especially now that we see polio here in the United States.
Well, Dr. Becky, thank you so much. We'll continue following this polio case and see if any others arise. From the studio, Megan Selensky, Erie News Now.